Ladies and gentlemen, to today's tutorial. Today we want to look at muscles of the anterior and posterior compartments of the arm. And simply for the anterior compartment, there are three BBC muscles, which we will look at them briefly. And then the posterior, just a single muscle, which we will look at. To begin with, this, is the upper limb showing some muscles, but we are interested in the anterior compartment of the arm. Now, this is the anterior aspect, and we can see this muscle. This muscle, the superficial muscle of the anterior compartment, is actually known as the biceps brachii muscle. Now, this biceps brachii muscle, the name biceps having two heads, therefore two origins. Now, one of its origin, we have what we call the long head and then the short head. The long head is actually intracapsular, coming from the supraglenoid tubercle, passing through the intertubercular sulcus, with the short head coming from the tip of the coracoid process, and then eventually merging, having a common tendon, biceps tendon, inserting in the radial tuberosity, the tuberosity of the radius. Now, this muscle is actually, supplied by the musculocutaneous nerve, which we will look at. Musculocutaneous nerve. Now, the action of this muscle is that, in fact, it's a strong flexor at the elbow, but a weak flexor at the shoulder joint. But in addition to being a flexor, it is also a strong supinator, of the forearm. Why? Because it inserts in the posterolateral aspect of the radial tuberosity, not the anterior aspect, the posterolateral aspect of the radial tuberosity, and therefore it's able to perform the function of supination, supination. Good. Now, when I take this muscle away, this is the first B muscle. We say BBC muscle, the anterior compartment of the arm, BBC. The first B, biceps brachii, which we've seen. Now, if I take away this and reflect it, now the next muscle that I will find deep to it, is known as the brachialis muscle. Now, remember that the brachialis muscle, originates below the, triangular shaped tuberosity known as deltoid tuberosity. Below it, the anterior shaft, of the humerus. And this muscle actually comes all the way and then inserts in the ulnar tuberosity. Now, this muscle is a hybrid muscle. What is the reason? The reason being that it has a dual nerve supply. The medial two-thirds, majority of the belly of this muscle is actually supplied by what we call the musculocutaneous nerve, with the lateral one-third portion supplied by the radial nerve. Now, this muscle is also a strong flexor at the elbow, Because of its role in being a very strong flexor, it is also known as the workforce, workforce of the elbow, elbow joint, workforce. Good. Now, so we've seen this muscle, that's the next B, that's the brachialis muscle. Alright. Now, the next muscle that we find, which actually takes origin from the tip of the coracoid process and inserts the opposite side on the middle aspect of the medial shaft of the humerus, is known as the coracobrachialis muscle. Now, actually, this coracobrachialis muscle is believed to have two heads, but in humans we don't see that. Coracobrachialis muscle, these two heads, let's say that, actually provides the way for the musculocutaneous nerve to pierce through and then supply it. So the coracobrachialis muscle is also supplied by the musculocutaneous nerve. Now, this muscle, we've seen its insertion, but in bears we have a third head. Which in human beings, about 1% of the population, really does it okay. And radiographs, we tend to find that there is, we saw the medial supracondylar ridge. Around that area, there is a spine over there, which we call it condylar spur. Supracondylar spur. Now, this supracondylar spur actually provides, attachment to this so-called third head of the brachialis, and it's this third head is often referred to as the Triceps ligament, the remnant of the third head of the brachialis in avian, but in 1% of the population you find that. This Triceps ligament therefore attaches from the supracondylar spur to the medial epicondyle, therefore creating some kind of triangular space, so that two of the content, the medial content of the cubital fossa that we saw earlier, that is we said the MBBR, that the median nerve as well as the brachial artery pass through it. Now sometimes this ligament may compress these contents and leading to what we call Triceps syndrome. So that is the brachialis muscle. The brachialis muscle, apart from being a weak flexor at the shoulder joint, is also an adductor, bringing the arm closer to the body, an adductor, as well. So that is the anterior compartment of the arm, the muscles over there. For the posterior compartment, there's a single muscle which we call the triceps brachii muscle, having 3 heads. Triceps brachii muscle. Now, this triceps brachii muscle, actually, it's having 3 heads, therefore 3 origins. The long head of the triceps brachii muscle is actually coming from the infraglenoid tubercle of the scapula, And then we saw that there was, this radial groove or the spiral groove, giving us, passage for the radial nerve as well as the profound brachii artery. In between them, the upper portion, which is little and orients laterally, actually provides attachment to, so this is actually the long head of triceps brachii muscle, and this is the lateral head of the triceps brachii muscle. It orients laterally. Look at it. This is the term lateral head of triceps brachii muscle. And we said that the lateral head of triceps brachii muscle originates superior to the spiral groove, or the radial groove. And then below it, majority, the entire shaft, medial aspect below the spiral groove is providing origin to this, head, which is known as the medial head of the triceps brachii muscle. And this triceps brachii muscle, is actually, supplied, by the, radial nerve. And, because of the position of the medial, head of the triceps brachii muscle, is also supplied, twice by what we call the axillary nerve. Branches of the axillary nerve, is able to give it. So one will supply it in the axilla, and then there will be another one supplying it at the lower level. Now together, all these 3 heads converge to form the tendon of the triceps brachii muscle, and then insert in the inferior aspect of the olecranon or the olecranon process of the ulna. Now the triceps brachii muscle is a strong extensor, at the elbow joint, Ladies and gentlemen, yes, let me just show this. We saw this. In fact, this is actually, most of it is the middle fibers, of the deltoid muscle. That's the deltoid muscle. but that's not the subject for discussion. We've seen the BBC muscles, and these BBC muscles are biceps brachii muscle, brachialis muscle, and then brachialis muscle, forming the anterior aspect of the arm. Okay, with the posterior muscle being just one, being the triceps brachii muscle. Thank you very much for your audience.